Hey everybody, this is performance video number 3 in a series that I'm doing on how I address patients and focus on performance. So if you haven't watched the last 2 videos, just go back and click on those links and just get yourself up to speed so that all of this makes more sense. But if you have watched those videos, you're in for a treat because we're going to be talking about strength, flexibility, and endurance today. And those are all really, really key attributes for every athlete to be able to function to their highest level. So all of those things, the strength, flexibility, and performance will not be available to you if your joint is unstable. So if you see the last 2 videos, you understand why. But just to review, if a joint is unstable, so in other words, all joints are meant to move in certain ways. They have aspects of bending and rotation we have little muscles around the joints that hold the joints together and control the mechanics of the joint. Those are not under our conscious control. We can't turn those muscles on and off. They're controlled through certain complex reflexes that I have many more videos about if you want to know more about. However, if something has thrown off or decalibrated the function of that system, then what we'll end up with is certain joints that are weak or unstable in certain vectors of motion. So in other words, when you move in a certain direction, you move that joint in a certain direction, you'll be stretching and asking for certain muscles to be able to contract to hold that joint and stabilize it, okay? Or at least allow the joint to move, but in a controlled way. The muscles that are holding that joint will actually lengthen and allow the joint to move in that vector. However, if that joint has been traumatized, where the reactivity of that stabilizing muscle has been decreased, in other words, your brain's telling the muscle to contract, but the muscle is kind of set at a different sort of state of activity, a different state of reactivity, even though the brain is telling it, give me 5 kilos of force, it's only giving 2. So when it needs 5, it only gets 2. What happens is the joint moves more than it should, and then you could potentially cause damage to the joint. So the body knows this, and so what it will do is it'll start this mechanism to recruit extrinsic muscles, or in other words, prime mover muscles, to try to resist that joint moving anywhere in that vector. So the effect that has in our bodies is that we just end up with these tensions in our neck or in our back or even in our shoulders or hips, anywhere really, but we end up with these muscles that are contracting to try to make up for the loss of function in other muscles. So whenever we have that scenario happening, what we'll see is that the joint will be limited in motion. But what I want to cover today is understanding what that means, like what's actually happening in those extrinsic muscles. So it's not that the muscle is contracting completely, but a certain percentage of that muscle will be contracting to just prevent that motion. So the best way to look at it is to understand that in every muscle, we have lots of little muscle fibers, and depending on how many of those muscle fibers are contracting will tell us what the tone of that muscle is. So if we see that a muscle has more tone in it or more tension in it in our neck, that's telling us that a certain percentage of those fibers are contracting to try to keep the joint from moving too far in one direction. Okay, so if you feel it and you go, wow, I can measure it quite accurately, and I can say, well, there's 40% of those fibers that are contracting. You have a 40% increase in tone, or maybe even a 50% increase in tone of that muscle. We're going to find that muscle will have less flexibility because you won't be able to stretch it as effectively because a certain part of that muscle, in other words, 40 or 50% of it is contracting. So when you try to stretch it, it won't stretch because that's what muscles do, they shorten. So if you have, say, let's just call it 50%, if you have 50% of those fibers contracting all the time, then your flexibility will be dramatically decreased, probably by about 50%, okay? So that's a problem. And if that's a muscle that you need in your sport, then you're going to really feel the loss of flexibility in that muscle. If you need that muscle to contract further, we're already at 50% tone, but if we need the rest of that muscle function, which you probably do if you're doing a sport, you only have how much left? You have 50% of the capacity left in terms of the strength of that muscle. So the fibers that are already contracting aren't doing anything for you. They're just tight. So if you have 50% left, you have 50% of the strength left. And that's a big problem because you probably need strength in your sport. If you are doing a sport that requires more than one action or action for a certain period of time, if you're a runner or a basketball player or a football player, whatever it is, where you need to be doing something for many, many minutes repeatedly, then you need to have endurance of the muscle. If you only have 50% of the capacity of that muscle functioning for you, then what will happen is the muscle will fatigue more quickly because you only have 50% of the fibers that are working. So you're going to use that 50% a lot. Normally, if you have 100% of the fibers working for you, you're certainly only using a certain amount. You're not using the full force of the muscle every time, but you're giving the other muscle fibers a chance to relax. So you're not overworking the muscle. But as soon as you start decreasing the function of that muscle or taking on a certain level of activity with tone of that muscle that's just trying to support the joint, then what's happening is you're going to work those fibers that are working much faster or much harder, and they'll fatigue faster. So having extra tone in a muscle, this is the summary in a sense of what I'm trying to say in this component, is that if you have muscle fibers that are contracting all the time, whether it's 20, 30, 40, 50%, then what that means is that you're going to have a decrease of strength, flexibility, and endurance of that muscle. And that is going to cause a very, very significant compromise to your function. So whenever we see this, if we focus on performance, then we know how vital it is to make sure that the tone of the muscles, of these extrinsic muscles, is appropriate. So one of the things that we're doing when we're assessing patients is we're feeling all the muscles. So when I feel muscles that are tight, it tells me that there's more tone in the muscle than there should be. Then I have to start asking the questions of whether that is appropriate or not appropriate. Most of the cases, it's not appropriate. There's probably a reason for that happening. So we have to start digging in and seeing, is that a chain of muscles that are contracting as a whole because of one compromise in one area, or is it actually just one muscle that's contracting because of the joint that it's controlling? So we have to kind of dig down and see, why is that muscle tight? Is it contracting as a consequence of some instability of that joint that it's moving, or another joint, and it's just a chain of muscles that are all contracting at once? So this is another component of what can happen. In the next video, I'll talk about chains of muscles, and I'll talk about how when some muscles contract, it turns off and weakens other muscles. So we'll do that in the next video, but for this one, I just want you to understand really clearly that when we have anything which is making an extrinsic muscle contract as a compensation for an instability, that's going to have very serious effects on our strength, flexibility, and endurance of that muscle and our ability to perform. So the only way that we can do that, now you can't, if that muscle, you feel that muscle is weak, you can try to train the muscle more, but you're only training that 50%, okay? Yes, you're using all of the muscle in a sense, but you're not actually allowing the whole of the muscle to function. You can train, but you're not actually going to be gaining a whole lot of strength in a realistic sense. If you feel that there's tone of that muscle, you're noticing that your flexibility has been decreased, we can do exercises, we can do yoga, we can do all kinds of things to try to increase the flexibility of that muscle. We can do long, slow stretches, which are great, but if there's still an underlying instability, lengthening that muscle and creating more stability, flexibility of the muscle that's trying to stabilize isn't really going to help stabilize your joint. Because it's the only reason it's inflexible is because it's trying to make up for an inactivity of a stabilizing muscle. So increasing flexibility isn't really going to have a long-term benefit. Is it beneficial in any way? Yeah, it is beneficial in some way. We know it is, but it's not massively beneficial. If we can increase the stability, then we have massive changes. So we immediately resolve the need for these extrinsic muscles to be tight, and we can immediately regain that full capacity of the muscle to contract with strength and to be able to relax fully, so we can see flexibility improve immediately, strength improve immediately. And this is why in practice you always see me doing lots of strength testing. Is I want to see what muscles are working before we treat and what muscles are working after we treat. And also I'm doing lots of motions of the joints where we're assessing the function of the joint. And if we see a compromise to the flexibility of the joint, if you can't lift your arm up over your head, it's probably because something is tight. If something's tight, there's probably a reason that that's tight. It could be, if it's in your shoulder, it could be because of shoulder instability or neck instability. So we have to dig down through these things to really understand what it is. To just sort of massage something isn't going to really fix it. If we want to get performance, we have to focus on things in a certain sequence of function. It's always stability first, which brings with it biomechanical function. And then if we resolve that, then we can resolve these extrinsic tensions, which will regain us our strength, our flexibility, and our endurance. These are all vital, vital ingredients to athletes. So I hope that that's of interest and important to you. If it is, then you can comment and like, and I'll try to address any of your questions in future videos. In the next video, we're going to talk about what happens when these extrinsic muscles are tight to other muscles and to our performance. So stick around for that episode. Thanks for watching.